Okay, so I just want to take a minute to try to tie together the document that we looked at for record retention and the standards of practice for pharmacists and pharmacy technicians, as well as the standards of practice for licensed, let me see the actual name, standards for the operation of licensed pharmacies. So we looked at those a little bit in class, but I wasn't able to tie it into how our pharmacy computer software assists us in this process, so I want to take a minute to do that now. So we have looked at the record retention chart. So really what the record retention chart does is just a quick view. It combines the information that we will see in the standards of this document here, as well as the standards for the operation of licensed pharmacies. So this retention chart takes the information from both of these documents and compiles them into a quicker document for us to reference, as opposed to reading through all the information that is in these two documents. So the one thing that I do want to mention is, and of course you will look at these in great detail when you get into law class. For now, what I need you to know about these documents is that it is our responsibility as regulated health professionals to know the information that is contained in these documents, and we are responsible for that information. So the person that is primarily responsible for the standards of the operation of licensed pharmacy is typically your licensee, which is, if you look in community pharmacy, would be your pharmacy manager. But it is not solely that individual's responsibility to make sure that these standards are being followed appropriately. Us as regulated health professionals are also required to manage this information and make sure that things are being maintained. Similarly, the standards of practice for pharmacists and pharmacy technicians, the information that is contained here, it is our responsibility to make sure that we are meeting these standards. If we were to identify a deficit, or if something wasn't being followed, because we are a regulated health professional that is basically taking on these standards as our own, we need to identify that and rectify anything that isn't following the standards as necessary. Okay, so back to this retention chart. I just want to take a minute to kind of tie together what our computer system, and for us, I will reference Kroll because that is what we use here on campus, and it is what obviously I'm most familiar with from practicing in community pharmacy as well. So when it talks about the patient record, it talks about the demographic information about the patient, and then a profile of drugs provided. So I just want to show you how our system manages that for us. All right, actually I'm just going to shrink that down. Nope, I'm going to close it, if I can get up there. Okay, so back to the main screen. I'm going to search for a patient. So when I search for the patient, I get many options. I'm in here more than once, but I'm going to pick this first one. So this very first screen that I come to, it shows me that demographic information. So it satisfies the information that is required here. So the patient demographics is indicated, and then we'll have a look at the profile of drugs that are provided as well. So we're going to look at the transaction record, and we're going to look at the patient record. So we kind of identified two different phases of that patient record. This first one is the patient profile. So it has all the information that we need about that patient. Of course, their name, their address, their phone number, their date of birth, their gender, language. Never change this language ever, ever, ever. If you change this, it will default everything that you process to be in the language that you choose. And I don't read or speak anything other than English. So finding a prescription label on my printer that's in Spanish poses some challenges, unnecessary challenges. NetCare is Alberta NetCare. Each individual in the province has their own individual number. We aren't able to do that because our training system doesn't allow for that. But you can see this personal health care number here matches their NetCare number. Alberta Blue Cross is the patient's third-party benefit plan, and we can go in here and we can see more details about that card and the information that would be on that card so that we can process the insurance claim for them. This information pertains to if we had additional services that we were claiming for through Alberta Health. That's the additional plan that we can use there. The patient's allergies, sometimes there's a whole list. Sometimes it would say no known allergies, but we need to always be collecting that information. If there was any additional patient comments or notes, maybe we have contact information for a caregiver, or maybe we have an elderly patient who their child has power of attorney, then we can indicate that information here. Kind of whatever sort of general sort of notes we want to place can go into that space there. Medical conditions, if they apply, then we might have something in here that says diabetes, hypertension, something like that. Patient is active. If they had an alternate last name, we have many blended families, so sometimes it's helpful to have an alternate last name placed in here. In this particular case, this patient is human, so we're dedicating this patient record to a human profile. If it was an animal, of course, we would check that off. If it was another pharmacy or doctor's office, we would create the profile and have it be specific to who it applies to. And then that brings me down to a situation where we might check off no crowell care. We might do that in the case of if we were providing medication to a doctor's office. Let's say they do in-office treatment of certain, with a certain medication, we wouldn't be printing up for that. We print the crowell care for our patients who need to have that additional information. Unit dose, if the patient had compliance packaging, then that information would be listed here. If there is, it counts how many prescriptions the patient had filled with us, and then it translates that into a dollar amount. So this is the patient profile, satisfies that need of the patient's demographic information, and then from there we can go into what is called the drug profile as indicated here. So profile of drugs provided, and that's where this listing comes from. This is all the medication that the patient had filled with us at our pharmacy. Ours goes back quite a long ways to 2012. You probably wouldn't see that far back in community pharmacy. Systems are set up to purge after a certain amount of time, but that purge also has to be consistent with this information for the retention period. So 10 years past the last date of pharmacy service provided, or for 2 years past the age of majority. So primarily it's 10 years that pharmacies are keeping this information, keeping it in digital format on the computer system. When they're purging it, it is usually going off to a cloud-based kind of a system or a server, oftentimes with an additional backup, and we'll talk about why that would be. I think I'll talk about that next class, actually. So again, this is the list of medications that the patient has received from us, and then we can look at this in a little bit more detail so that we can see that transaction record. So they talk about the transaction record here and the information that needs to be provided on that transaction record. We affectionately call that our hard copy. I'm just going to take a look. I can pop in here so that we can see what would actually print out of the computer system for us. So these two top components up here are the prescription label, and again, there's very specific information that is required on that prescription label that is stated in the standards for pharmacists and pharmacy technicians. And then we have our transaction record. So the transaction record has the prescription number, the information above The line here is all of that demographic information that we collected from the patient. It includes their Alberta their Alberta Healthcare number, there's their party information, date of birth. So all of that in that record comes over onto the transaction record, information about the drug that was dispensed, the VIN number, information about the prescribing physician and their demographic information, the SIG information for the patient, and the original number, what we dispensed, the cost, the third-party information, all the allergies. So all the information that we've collected kind of gets collated onto this single document so that we are satisfying these standards of practice information. So our computer system really does do a big job for us. It collects and contains all of those requirements that are needed for this record retention. The record of care, those kinds of things. So if there was any additional information, we could actually supply and support what we have within our patient record. We can add additional information within this space here as well. And again, the functionality that we have in our training environment isn't quite the same, but there are things that we can do with charting, consent, if we got consent from a patient for various things. If they had a credit card for delivery, we can save that information there. Patient documents, so anytime I've transferred anything, it collects all that information here. This history might take a minute. Anything I've done with that patient, all of that is collected here. So it does provide and support the information that we need to satisfy the standards of practice. And again, I just want to mention that, I'm just going to try to close all this. It is our responsibility as regulated health professionals. We are assuming the responsibility for these standards of practice, and if we do see that there's a deficit, then it is our responsibility to rectify that or bring it to someone who can rectify it. And then, of course, making sure that that situation has been rectified and, following up and making sure that things have been tended to.